There's still so much confusion, Hilary, about quarantine particularly. We now have all the devolved countries, all the different countries interpreting various quarantine rules in a different way. We were trying to talk about this yesterday, about the sort of complications and the confusion. Certainly they're finding in Manchester, big U-turn in Manchester as to whether they were going to lock down. They tried to lift the lockdown, then they did that U-turn. How are we supposed to interpret what is the right thing to do when each of the governments of the UK are interpreting the rules differently?
It's extremely complex and confusing, isn't it, for everybody? Everyone's very frustrated by it. Look, I think Wales have made a decision about Greece because one plane load was affected by 16 people who contracted COVID-19, 16 people on one flight from Zante. So they looked at that regional area and they said, look, we've got to crack down on this, and we can't just regionally crack down on one island, because there's lots of mixing between people travelling to and from different islands. And even Greek people who go and have their holidays in those islands will increase the transmission rate. So Wales take the devolved, isolated decision to put the whole of Greece and those islands in the quarantine list. Northern Ireland and England haven't done that yet. They're saying, well, let's look at the transmission rates. It's borderline. There's not much difference between the decisions that they're making, but it's confusing to passengers, and there does need to be some kind of consensus in the devolved nations as to what we're going to do as a nation. The Foreign Office give travel advice that applies to the whole of the UK, but the devolved nations control public health, and it's those public health directives which determine which countries are put into quarantine. So there is a difference, but it's a very marginal one, and I think it would be very useful if they all got together and said, what are we all going to do together?
It would definitely make it easier, wouldn't it, for travellers when they're working out where they're going to go and how they're going to get back.
Absolutely.
Also, of course, it was a back to school for a lot this week, wasn't it? My daughter Ella Rose had her first day in year one yesterday, and there's talk now about the difference in symptoms for children to adults regarding coronavirus, because, of course, they're all going back to school, they're all mixing, there are going to be coughs and colds.
Sure.
But I guess everyone's going to be on alert, aren't they, looking out for things that could point to something more serious?
The cardinal three symptoms have not changed. We're talking about fever, number one. We're talking about a persistent dry cough, number two. And number three is the loss of taste and smell. Now, those are the three cardinal symptoms, and those are the ones that if you develop, you need to go home from school, you need to self-isolate. Now, there are other symptoms that have been associated with COVID-19, but they are so nebulous that they could be confused with lots of other things. So thousands, millions of people get diarrhoea and vomiting every year in the UK, but children particularly seem to be affected if they get COVID-19, which is a rarity in itself. Sometimes nausea, vomiting and diarrhoea can be a symptom. It's not a cardinal symptom, but it can be a symptom. And a trial that's been conducted in the States, they've looked at nearly 1,000 children and found that quite a significant proportion of them that had COVID-19 had nausea, vomiting or diarrhoea. So it's something to be aware of. Certainly you wouldn't want to panic if your child had a tummy upset, because they're so very common and usually associated with something else. But it can be a symptom of COVID-19.
OK, good to know what to look out for.
We were promised, weren't we, Hilary, a world-class test and trace system a number of months ago by Matt Hancock. I think it's anything but at the minute. I think the whole situation with test and trace is very, very complicated, but certainly not up to scratch. The Mirror's had some analysis that 45% of contacts were being reached by call centre staff. In order for this to work and for us to avoid a second wave, we need to get up to 68%. That's one thing. But the other thing that's coming about is the fact that people are being sent, some people over 100 miles from their home, to try and find somewhere that is capable of taking them to have their test done. It seems extraordinary that even after all this time, and of course more and more people want to get tested and we want to have that capacity, but we still don't have a system that is fit for purpose. No.
The labs are being overwhelmed by the demand for tests. We're doing something like, nearly 200,000 tests a day, but the demand is growing. And we need to get those tests done. It's absolutely pointless asking somebody who lives in London to travel to Cardiff or the Isle of Wight to get a test done. These people might be ill. What do you want to put them in a car for several hours? You need to do the test nearby, and you need to get the results quickly. So that's a major problem at the moment. What the government is saying is, well, we've actually sent several tests to areas where you've got more cases, to the neglect of other areas where you haven't got many cases. But that would miss a spike in those cases where you haven't got many cases at the moment. So it's not ideal. The other thing is, if we're not tracing everyone who's been in contact with somebody with COVID-19, we're missing people who will transmit the virus to others. So we need to improve all of those things. The other big argument at the moment is whether we should be screening in airports. And everyone's saying, well, look, other countries are doing lots of testing in airports, why don't we? The problem with that is we don't really have a screening test that is that reliable. If we screen when people come into this country, we might pick up 7% of COVID-19 cases, even if they're asymptomatic. But that misses 93% of cases that could come into our country and transmit the virus
argument, though,
to the public.
7% is better than none. I mean, admittedly, it's not enough. But if it 7% still catches some.
It catches some, but it misses 93%. If you do a second test 5 days later, you pick up 87%. So that's a huge protection for the public. Now, what I would say is, to these countries that are being vaunted as saying, oh, they're doing the screening, their economy is fine, let's see what happens to their transmission rates, because it could well be, as we are seeing in France, a significant rise in cases and more hospitalisations as a result of that. And that's a country where you've got your screening in airports. So screening in airports is not necessarily at the moment the be-all and end-all. What we need is a rapid 20-minute test which has got high sensitivity, and then that would be a game changer. We haven't got that yet, but that's one of the reasons why the government is investing £500 million in studies that will give us a quick test. If we get that quick test, which is reliable and protects the public, then we're onto something.